Kathleen is a new customer, and I'm going to ask you a few questions to give her the best skin analysis. First, we're going to clean your face so we can see your skin better. So tell me, Kathleen, do you work out all the time?
Um, just around my female time.
Okay, just around your cycles.
Yes.
Where do you usually break out?
In my T-zone.
Your T-zone.
Mm-hmm.
Do you have any history of acne in the family?
No, nothing too severe.
But did you have breakouts when you were a teenager?
More than I do now, but never all over my face or anything.
Okay. Are you taking any medications?
No.
Birth controls?
Yes.
And you still break out with the birth controls?
Just like, a few blemishes here and there.
Okay. But just around cycles, not all the time?
Right.
Okay. What's your concern about your skin? What do you want to improve?
I get red, some discoloration,
Okay.
and dryness,
Okay.
and my pores bother me.
Okay. Do you use sunscreen?
Not often.
Okay. What about any other skincare products?
I use Epicurin and Circuit.
Okay. And you like the products?
Yeah, I just started using them, and they're pretty good.
Okay. So you wear makeup every day?
Pretty much.
Okay. And what do you use to wash your face?
I use a Revea Mint Souffle Cleanser
Uh-huh.
and Circuit Savior.
Okay. I'm just going to look at her skin for a second. Yes, you do have some clogged pores and some congestion on on your chin, which is very normal when you're around your cycle, because this is the hormonal area in our face. Um, you're a perfect candidate for a lot of stuff. I'm going to do just a basic facial today, meaning just a deep cleansing, clean your face and everything, but you're definitely a candidate for something more aggressive because you do have that nice fair skin that you can do some chemical peels that will make you see more smoother texture and it will minimize your pores too. And you control your oil too because the chemical, kind of kills the bacteria in the skin. You can do chemical peels all year round. You can do them a few times a year, but this is a good time to do it because of the weather's changing, so you're not so much exposed to the sun, so you have less chance of getting discoloration. But you have to use sunscreen every single day, even if it rains. Okay. So I'm going to exfoliate you a little bit, just a little scrub, and then I'm going to put the peel on your skin that is going to tingle a little bit because it has some alpha and beta hydroxy like glycolic acid and salicylic acid.
Mm-hmm.
Salicylic acid helps to releases the cloggedness of the oil gland, so it's really good for people that have more of oily skin. It's an anti-aging acid too, so it's good for hyperpigmentation and people that are concerned about texture and lines and wrinkles too. It depends on the pH and the formulation of the acid that can work as an anti-aging too. So you're getting a little skin lecture from me today. That's a facial.
Yes.
You get education.
Yes. It's good to know about this stuff.
Yeah, so that way you know what you're getting, and then when people ask you, you know what you got. Because
Right.
most people say, "Oh, I went to a doctor and he did that peel," and I don't know what they did. And we need to educate our clients and our patients to teach them so they know what they're getting. So
And they take better care of their skin.
absolutely. Is it too rough?
No, it feels good.
Okay. Just to kind of take that first layer of the dead cells, and then the other peel that I do, which is an application, it's you don't scrub it on the skin. You just brush it on, it stays on. It has the ability to penetrate to the skin, and then that will releases the, the cloggedness in the oil glands. So when I do your extractions, it's not as abrasive and uncomfortable
That's
for your skin.
good.
Your skin needs that exfoliation because when you use makeup every day,
Mm-hmm.
that can cause breakouts too sometimes.
Yeah.
Because if you don't wash your face properly with the pollution and the smog in the air and your oil production combination of all, you can get congested.
Mm.
So bacteria sits in it because there's dirt in the skin, and then you can get breakouts. So it's very important, for anybody, even if you're not using makeup, but to remove everything so you don't have that problem, um, you know, with the skin to be congested.
Right.
So that's going to tingle a little bit. Do you feel it? Especially right there because you have the breakout.
Yeah. I feel it a little.
But it's bearable, right?
Yeah.
Okay. You can stop the video now, I think.
Okay.
Can you stop it? We can edit it after, right?
Yeah.